How are you?
That's what,
Hi guys.
that's what I heard. So just so you know. I'll walk in. All right, Ashley.
What kind of excuse to chuck you? My tovers? Yeah, guys, look at what you, oh, my toe, yeah, yeah, right.
I
like it.
have to be fair though.
Yeah. That's what you're speaking.
Well, everybody's putting in their refill orders now. This batch is
I
from
was
this
so
summer.
excited last year when she did that.
My wife, she gave me her notice that she's retiring. So she goes up to the supervisor and says, you know, and she had to have me on there replacement whatsoever. So she goes up to her and she says, well, you know, what I'm willing to do is I'd like to work 4-day shifts instead of 7. She's 7 on 7 on. She wants to work 4 and then be off 11 or whatever, you know. And Patty comes to the front and says, that's not going to I said, I'd say, when she said she can do 5 days. For quite a while. She's good.
So it's 5 days.
Yeah, she works 5 10-hour days instead of 7 10s. And she'll do that, and then it's like every other week. So she works like 10 shifts instead of 14 shifts a week. And that's a good step down now. I think they have. And she says there are so many.
I get emails, would you like to apply for this? Yeah, I'm like, nah. Oh, retail, yeah.
Yeah.
Yeah, that was it.
She's 68
So
now.
she's being like Lynn Roman. Sort of.
No, she's 62.
Right, like, it's okay because I know I can't retire
Yeah,
anytime
she's
I want.
62. So she wants to wait at least a year before she draws Social Security.
Oh,
So
yeah,
she, and in doing that, she's still with like a pension.
Yeah.
Well,
That would not be
I
my.
like this gig.
Oh, yeah, you.
I will do, I have to, I will do one more. And
Yeah,
then I think I'll be ready.
Yeah,
yeah.
but you know
At
when
least
you're
there's a light at the
ready.
end of the
Yeah, and I'm not quite there yet.
Yeah.
Although it will depend, so we leave on the 3rd for the first ski. Then we go skiing at the end of February.
Yeah.
Then we'll go back on the Arizona trip that's been scheduled twice, canceled twice. Like in March or early April, and then the cruise, the big cruise, and then training.
Oh, that'd be
out in
nice.
June.
That'd be nice.
So, I don't know, maybe I won't be able to fit in right now, but I'm trying to get
Well,
all this.
yeah.
But
We're still going to Portugal in February for like 3 weeks.
Okay.
And so what we're gonna do is, because the plan is,
He's the one I could.
we want to get there, get 4 different cities to see what the weather is in February. Because it gets too cold. I thought,
Why do you go Ohio?
if I leave Ohio, I'm one spot I want to go to is South America, Spain. Yes, that's like real cold. So that's supposed to be nice. So if we had to, but she knows.
Yeah, he could see.
So you have a choice to go anywhere in the world.
And if the Lions are taken, right?
Oh, yeah.
I like the cold weather, but I like it when I can go to and fly back home.
Well, I like cold weather, but I go skiing.
Right,
Yeah.
exactly.
Yeah, well, that's good.
If you live around here and you got nothing.
Oh, that might be our guy then. Oh, that's good.
This is our, what's this?
I don't know.
Yeah, the church people be interested in Detroit.
I think a lot of this is like. Let's see. My stars training people here is maybe this is the.
Oh, it's good. Yeah, I don't know. I don't know. No, Ashley doesn't know. She knows. Okay.
Oh. Yeah. It must be.
Yeah, I only read the and I think it's because to make accommodations for better equipment for that.
Yeah. That's-
only assumption.
So yeah, I'm not up there ready to get one. So. Absolutely.
Yeah, I'm
Believe me.
hoping I came and talked to Adam about zoning.
But
I want
this
to
was all.
make sure, I gave him my,
We still have probably
we need a presentation.
3 gallons. We got stuff.
This is what I
2020 and
want.
2021. You know, I think we did use them.
That's my biggest use of education. It sounds like.
Like I said, this year
And I
was
said,
a
this
big
is-
year. Still, we got, I think,
Discussion in this office, and I'm okay.
4 or 5 gallons.
And I said, if we're approving feet, and we're not approving.
But these guys, they started to seal
Not
up the hives
approving what
early this
else.
year. Yeah, go back.
And that's.
You need a core block.
So, and I brought that up.
And I said that, and I said, all I'm approving is deciding 185.
Because the way that they,
$100 over 5 years.
they just kind of hang out there and keep playing.
Category 1 and category 4. And I'm here to talk to Adam.
We did have
Excuse me.
one hive last year. So that was- That's all pretty good.
These are specific, that we're using commercial. Exactly. I'm happy we got that down here. We're gonna be, it's 250 rather than 185, which is comparable, so I'm happy with that. But these themselves are okay.
They
I'm
have
concerned.
So early on, I get cold.
Process.
So later on in life, you get like mold around the area where certain colors.
I don't think we should allow.
So most of our properties.
I don't think we should allow.
Dairy, dairy farm, so that's all, my yard is all dandelion, you know, and I don't think we're gonna grass there at all. And so there's like 10 acres of it out there that they do, you know, so they do, we put our garden boxes, but, you know, but they just find some flowers. And then I could plant a lot of seeds, they're beet bread seeds, you know, and stuff like that. All right, good.
Hello, you look nice.
Christmas, is it for a Christmas party?
That's right. We're not getting one. Right. I'm not in favor of this.
$12 turtleneck. Crispy turtleneck. Glad I told you.
I brought the lunch today. I asked Adam to make accounts, get rich, because next week they meet on Monday. We're not gonna have as many people. We should cut it back. Next week. What do you guys feel about signs here?
I am really behind on this Wednesday with this lunch thing. I need to get rid of
Well, Rich did the first week, I did the second week, Lynn did today. So there's, you say it's not Wednesday, or when is it next week?
It's Wednesday, but by Monday.
What we did was we've been going to Farmer than Ellie. And they've been making up the sandwich. Yeah, what they did last week is they changed it up. They said, I think the first week they had turkey and roast beef. Last week they had Italian, they did some Italian and some smoked ham. And then they put fruit.
And I have to be there, right?
Yeah.
Well,
I know.
All right, I got Rich from that special needs and five bucks. That was around here later.
That I saw, but I was.
Yep, sorry.
Program update or need update. We had the Alta.
Yeah.
I don't know if I pulled up on my phone because I saw it.
Sorry, I don't have that. I have.
Have a slide.
Yeah.
That's fine.
And I can actually give
No,
you.
you're good. I just was gonna.
Okay, and so the reason.
Why do we have
So
to?
some criminals.
I don't know, like, some person. Okay, so I see. And I think so the things I think are.
You know, 4 months maybe, supposedly 6 months realistically, but they said 4 months in an email recently. Right. Went through it, passed it, didn't realize it.
Okay, so I read that, you're right. No, no problem with that. Our concern is
I'm just gonna affirm my feelings about commissioner taking a constitutional oath.
we don't want anything.
That makes sense.
But I should talk about that.
Ohio Revised Code doesn't require him or her to take a constitutional oath, like every public official does. And just based on, you know, that,
So you're.
that balance between advocating for health and protecting individual constitutional rights. You know what I mean?
Well, I understand I'm learning from you. I gotta tell you, I have not read the Constitution.
We've been given a lot of concepts.
Yes.
I'm like, I get.
Yeah,
Okay, generous.
I did talk to him a little bit, not a ton, but I found out today why that was. Actually, it was a reduction in activity. It's 250 now, how the Septic works, it could be 200. We're not actively enrolling them in that, but if they happen to. Right.
Yeah, I don't do that, but I'm fine with that.
Can you have one of the staff go do that?
Yeah, I'm gonna grab him because I told him. Hey folks, everybody go and take a seat. We're gonna get started here. Yeah, sorry, go ahead and sign it again, yeah.
They're just the cheap ones. I got like 6 times.
Yeah, I did.
You know, this was intentional today. It was totally intentional. I got my Italian horn on. No, this is my sage right here. My grandma.
You just give her a regular. I'll put that.
Probably too big. Walk around something now.
How are you?
Good, right? They got Christmas party, you know.
Dave, the mic in front of Dave will include the whole speaker system here. We got to put your mouth close to that mic for all of you to know.
Okay, are we gonna hand it around, Ben?
If you guys want to, if you're loud enough, it's that same thing from yes, last time you have to fix your mouth.
No, no. Yeah,
Guys,
all right.
high tech. Yeah.
So he asked, are we okay with the fee? And I said, I'm okay with the fees, but I need it. So I said,
We know. I told him, she called him. He said he can meet us on Wednesday. Yeah, it's Tuesday, Thursday, or Wednesday, Thursday after 5
Yeah, the other thing.
That's what I kind of heard. Yeah. 100%. I think you're slippery slope. Yeah. Right. No, that should be your, right. No, that should be your first thing. Yeah, that should, it has to be a little. Okay, good. Thank you, John.
Yes. Oh, yeah, you
She
too.
just, no, not me. She's her. I know she's a rock star.
I know,
all night.
I know, I hear you.
This is what it was. Anyway, so tonight, 5 p.m. Wednesday or Thursday.
Oh, okay, that's
Really. Call. I need both of them. I need one. All right, you ready?
Yeah.
We're past 5. Yep. All right, folks, you take a seat. Start the meeting.
Good evening, everybody. Please stand for the pledge this way. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
For those that are new to the meeting, we are having the meeting live stream tonight. The county IT department is here as well as one other one. The League of Women Voters here on the left. So you can go to either one of their 2 pages to watch the live stream. Please be mindful when you come up to the microphone here. Don't hit the or it's not the microphone, the podium. Don't hit it too hard, but we'll speak at the podium like we normally do. And then the board does have their microphone that we'll try to use. Obviously, as you're all aware, it doesn't project the best. So most of us will just speak louder, and that way you can hear us. Mr. President.
Okay, so did everybody get a chance to review the prior meeting minutes?
Yes.
Okay, so move to approve the minutes for the November 24, 2021 regular meeting of the Board of Health. Do I have a
So moved.
motion?
Second.
Okay.
We don't need it.
You're good. I got it written down. We got the recorder going.
Okay, so all in favor?
All right.
Aye.
Any opposed? Okay, that motion passes. So next on the agenda is the executive session. And the reason we have to go into executive session is we do have somebody here from the attorney's office, so we want to be respectful of his time and talk to him.
And this is for discussing pending litigation with counsel as well as matters of personnel.
So do we move to adjourn to executive session to discuss pending litigation, and counsel must be a roll call vote? Make a motion?
So moved.
Second?
Second.
Okay, Ms. Jones?
Yes.
Dr. Levan?
Yes.
Mrs. Roman?
Yes.
Mr. Gregg?
Yes.
Rich Perino? Yes. That one passes. So we're in executive session at
Yeah, we'll go.
3 minutes after 5.
And Mr. Chair, who's going to be invited into the executive session?
Just the lawyer, Pat, and myself, and the board.
And the lawyer's name is what?
Casa.
Okay. That's a requirement. That's a true dinner.
I don't know what I'm cranking the bag of the So I'm like, they're gonna go in a meeting, and then I'm just gonna wait
You know, much later. And I always.
I mean, they're gonna be in there for a bit. Not a yeah. Yeah, yeah.
like 3 years from the people who are running. Like, all that. I'm telling you, I well, that's what we're trying to do.
No, usually because
I just managed another bunch of still
I got it, thank you.
But honestly, you could say, I did that for a concept. To see who would pay attention.
See who's paying attention.
Yeah, you know, like, I just check to see if.
Fred May is yours. Yeah, sure. It's the memorial. For Geauga County.
Oh.
Association. It's called the House. In Ohio Council. There's nothing there. 88 counties in Ohio. 87 county department.
I need to have it in
Oh, it's just county.
I'm mixing this. So member every township. All right, I'm trying to follow.
Making sure the machines that they use and so forth. I just wonder because it's a I just wonder. Looks like you got a lot of honest people. You vote to join a lot of volunteers and so on, and take care of everybody, and check in and so on. It's wonderful. Yes. That's good. Yeah. It is. I've seen it run very professional.
How does that handle that? You're sure that the stepdad did the
Yeah.
Now that makes sense. Thank you. I appreciate that. That's important.
I didn't know any of this stuff. And I was so happy I did it.
About various forms of ID, not everybody has a driver's license or an ID card. Right.
Take the word, you worked out in 7 years.
But it is easier when they come here.
It requires something. When you. Right, yeah. Sure, you're done once you make it.
But I would say we don't want to like 95% of them already.
You know, Ohio should. Should get free identification. Free. Yes, you should not have to pay to be. That's what I mean, you should not
I remember I think it's not really cool. Well, that's what I thought.
I was a little hungry, then I saw that. Yeah, that's all too bad.
You get close to the end.
Yeah, it's sitting up, but it's kind of.
So it doesn't fall.
Yeah, it's resting. Yeah, I'll check. It might be this way, but just the sound and stuff. That thing is.
When I
I mean, also at the same time, I realize it's also they're trying to at the same time. Like, as you were
Somewhere in the pilot
you better be really good. Like, how much is it for your income? Like like 4 or 6, then like around 3 grand.
Well, that's what it is. It's like,
Yeah, you could also kind of say, oh, this is any like sci-fi shit, but I'd be like, exactly. Right. I get it, like, so like, basic, probably a lot of stuff would
I got this one.
yeah.
I was at the radio station. I worked Yeah, I don't know where she is. She has a friend that's
Grandpa can't say, where do you go?
Yeah.
Okay, we're done.
When's the last time you went out to? They're each got their everything together.
I was at the gas station today and I saw the car next to me, they got something They're probably texting each other. 2 years.
Roll up and then like, hey, they're going to we're not shooting my head. Right now, like in the
Right.
Oh, I later when you have done this, like, this is what like. Right. Or yeah, like they kind of go. Yeah, like, here's what I said, my video and
Oh, man. She went so bad.
No, but I know what that is.
Oh, yeah. I didn't want to go again until the end of the night. They decided to get rid of all I was
Oh, yeah.
Well, there are times when you I give them credit. I can't. I give them credit.
I have like a whole.
There are times when
Yeah, like, yeah.
So you're like,
I should just try right
we have very different. Education. Like, it's never gonna end.
It's all logistics, right?
They never used to see her. 3 years ago, did you hear about her? I don't know what they do now.
You should go behind and not do it.
My turn for my round.
Interesting, my wife's family.
Those that have authority. There's a situation.
Yeah. Probably wouldn't really. Yeah, exactly. That's it. Man, you know. So hard for me to like. I thought they did like a voice change. I like the way the voice changed there, so you meant it's not. Yeah, it said it was a fire. Yeah. I really like the matter. Rich. I like a lot of those, very like, it's a lot of it in everything. Especially, that whole secret of yeah, they could have kind of done that a different way.
Hey, Gary.
I don't know, but I know the history has that's what we kind of have to do. That commission review.
You know, when you're just They move the team.
I don't know, I would
Yes.
I can leap over this.
Think about it around here somewhere, right?
Yes. Right outside.
Okay. You know what? You're one of the best teams.
Yeah. That's nice.
Well, Charlie, you can't find out what I want either.
They weren't in the restroom, I checked. They weren't in the men's room. They're hiding.
I was just saying, I wish we had coffee or
No.
Well, it's been a good conversation. I think
You told me that. It's so true. I haven't watched it. It's so depressing. But no, not the problem. I'm watching to see what happens. It's not that pretty close. The greatest coach in the world now. Oh, he must love your coach moving. Our coach moving there. It's a Tom Brady thing, huh? I give him how long he's lasted and just like, you know, I think he'll go another 3 years. I think he'll try to finish another 3 years. Doesn't he? Yeah, he's a good I mean, he keeps it in good shape. Yes. Oh, no. There's only. No, just that. Well, And you go to you go to the team. And of course, you watch the people. Yeah, he's tight. Yep. Yep.
I love that.
He came out of the tire.
I love the these are the people who I'm sorry.
It's hilarious.
Somebody please shall we order pizza for everybody?
Ohio State colors.
I'm sure you don't, but we're getting quite
You're
generous.
super The next place I want to week is past the big overtime game. Resolve it. What is he talking
You know, we're learning about all the
I was just saying, you should play charades. I don't know, he was gonna go find us.
No, I just had to use it.
They weren't in the bathroom. Still have people hanging out with us. They're like,
Oh, geez.
they're gonna be free.
You get people that walk by here.
Yeah. My mother. Hey. I'm at a Philadelphia. Yeah, call next, okay? Oh, sorry. I'm not gonna be home until later.
I can't do it. So we can find. I told her.
Well, you don't know.
I got her see. I got her.
And I'm like, are they trying to change? Yeah, I understand that, but when they were talking about. Pick up that. But they never.
Right, so we try to have. And he's mad, so I dropped it over.
There's another. I'm not gonna disagree. I'm not gonna disagree. I know I sit here at 7 in the morning and I'll be here.
Right. You have that one left.
Can I want to say something?
That's not our.
I don't want to.
That's not our. No, it's being.
Yes.
Like, I wouldn't say you're being
Yeah.
I know.
Other than not over. The dogs have been the name of it's possible, but still. The only thing I was never doing. I think he's a great receiver. He just does not let him go. He's always got Oh, really? I thought they made it to the second round. Pessimistic.
Yeah.
Pessimistic. Oh, right, because you don't want to let your hopes up. We used to have dinner Sundays at halftime.
As I get older, though,
Yeah, most people. Not surprising, that's why my grandson's
Oh, yeah, we're still waiting. Yeah, it's a movement in here, yeah. No, we're still waiting. So now you got. So I gave I gave up. I retired.
We're not live streaming it there. We're not live streaming it there.
Are you on?
Come on, look at that hair. That hair is so accurate.
Now that makes sense. Washing your hands makes sense.
We know now, no one should be in this. This happens to us enough times now. I have checked at home, I need to make sure.
At least they're better age, so.
Horsepower was halfway through the year. So you got to repass.
Yeah, that's how you call your. On a ladder,
Yeah,
yeah.
I wish. I got one in Tennessee, one in. I got it fixed.
Yeah.
How are you?
Yeah, it's not, yeah.
I don't know why. It sounds like how you small.
That's how you're gonna sell?
Somebody get a more weird one, right?
Many cases.
We should have just zero.
Not just.
I think we should be ownership.
Great state.
On his beer and pizza.
One underneath the electron microscope, we can see the weather.
I don't know, I can
That was up there with her.
I know.
Meeting those challenges. Changing the way you speak.
You know, like I was walking down the street and my daughter was yeah, no problem. And I mean,
You can see on there, point straight to your heart.
yeah, they're walking around.
Whatever you think. Yeah, are you I know that.
I had a video. I mean, I haven't.
Yeah, we'll return. Come back from commercial break.
Right. Intermission.
I mean, I don't go. Yeah, the worst, it's the worst one.
Saw my daughter.
No, that was good to see.
I didn't take that.
Yeah.
But anyway, so she. The nice thing is, but Detroit's kind of strange, it's like you say, this was. But I mean, like. The radius around it.
Bottom line is.
Yeah, it's just ground. We already have a lot of. They got it. Right. I think. I mean, the freeways are like 7 lanes. You know, you get out, you get home, you need our.
That's so typical.
I don't understand this conversation. I don't know why that.
Can you make a comment?
Right, but there's
Oh, yeah, you're using that webcam?
no, that's right.
Yep. So what's the deal? You're present up your desk.
The thing right here?
Yeah, I think they're having questions here. And then we have a mic and everything. I don't know if they're gonna keep the mic. Yeah, I think so.
I didn't know if that was there with the camera close to it. Well, you know, if you don't.
Just want to let you know, you're going to be interrupting the citizen meeting we're having here. And so.
I hope you took minutes.
We're getting ready to go into executive session.
There better be some
We've
legitimate.
got about an hour, we'll be back.
Oh, look who walks in.
I've been here.
You better have some minutes for this meeting. The public, I better see votes and everything.
You're not very observant. I've been here from the beginning.
Yeah, it is. Yeah, if I can't see, I'm blind.
There we go.
Okay.
So we are reading this or we're not reading this? Okay. Not a problem. No. Okay. No, really, no.
Oh,
It's a 4:30.
All right,
We'll go into.
yeah, I know.
Rich will do the,
Are you gonna be back?
yeah.
Yeah,
Okay. Move
okay,
out of executive.
so, do we have a motion to move out of executive session? It is, 6:40.
So moved.
I second.
Okay,
Yeah, he's got
so
second.
roll call vote, Ms. Jones,
Yes.
Mrs. Or Dr. Levan,
Yes.
Mrs. Roman,
Yes.
Mr. Gregg.
Yes.
Rich Moreno, yes. Okay,
I'm gonna put the slide up.
okay. So EH committee meetings, Ashley, do you want to talk about that briefly?
Yeah, absolutely.
Okay,
So essentially, once monthly, myself and Rich, Mark, Dave Sage, and Adam and Alta Wendell have been meeting to collectively come up with a plan for our county for the operations and maintenance program for household septic treatment systems. And this program is essentially in line with programs that other counties throughout the state are required to have by the Ohio Department of Health. And the important premise of this program is to make sure that we are protecting our waterways and first and foremost, the Clean Water Act. So for those of you who live in this county who have a septic system, you know that they do require a lot of maintenance, and depending on the type of system you have, there's different components and different requirements. And a lot of the times, the good news is if everything's working fine, they're out of sight, not of mind. When they stop working, you definitely know about it. So the parts of this program, we are talking about preventive care here. And how can we make sure that homeowners are aware of what the requirements of their systems are and how often they need to take care of them. So we are developing a program, and some of these we are currently working on to establish some fees that we have come up with some good reductions in fees and are making sure that we are in line with other counties. And we are talking about what fees we establish and how they are going to be incorporated into some of the other fees that we already charge homeowners and what we can take away to make sure that we're not causing any additional financial burden to anybody in this county. So that being said, at our last meeting, one of the things we did talk about was for our national pollutant discharge elimination systems and spray systems. These are the systems that include a lot of different types of components, pre-treatment systems, and spray irrigation is a special device. And that is something that the Ohio TAC Committee, who is in charge of looking at these new and innovative types of systems, they establish the requirements that are for these systems and how we need to go about inspecting them. Based on the information we have from other counties, from ODH, we go ahead and look at what do we need to test for these and what fees we need to establish. So that's really what our last meeting focused on, was coming up with a fee for those category 4 systems, and then discussing some of the components of the for sale of property program that we have in place and how we can kind of prevent people from being charged additional fees. And so with that being said, we discussed the category 1, which are all on-lot soil absorption systems, which essentially, those are the systems that you have somebody come out, pump your tank every couple of years, look at it and say, this is good, this isn't good, you should call your service provider. So those are the two we really focused on. Mark, Rich, anything to add with that?
Well, you've taken care of everything.
Okay,
very good, thank you.
okay.
You take any questions? There's no public comment session in this one, but at the end we can do that. But also, Mark, do you guys still want to hear about category 2 and 3?
Yes.
Yeah,
Yes,
can you explain category 2 and 3 and then why the reduction versus, because that wasn't something we discussed in the original EH committee.
So the category 2 and 3 systems are similar to your on-lot soil absorption, but they have a mechanical component, either an aerator or some other device. And so they do require a little bit more maintenance. And so one of the things as part of the program is it's going to cost a little bit more on our side to manage the O&M program. So the fee is a little bit higher. But what we try to do is keep all of our permit fees on somewhat of a consistent schedule. So instead of having a 10-year permit, we just basically moved it to a 5-year permit. And that was really what the changes that we're voting on. So now all our permits are either 1 and 5 years instead of 10 or 20 years.
Well, what you have up there is old permits, so you have almost 10 years.
All the old permits used to be 10 years.
So what's 20 year? I'm sorry, I thought you said.
Well, there was some older permits that still haven't expired yet that are 20 years, but those were put in so those were, we still honor anybody who got a 20-year permit, but as of 2015, everything went to 10 years. But anybody who had a permit before 2015 had a 20-year permit. But the fee, we didn't put that up there. I mean, I could put it up there the next time, but there are 20-year permits out there still.
And when is this fee paid?
When is it paid? Or currently these fees are paid when somebody gets a new system installed. So it's part of your permit to install. They're going to purchase your operation permit at the same time.
And so if your system was put in 40 years ago, have you paid fees since then?
No, you have not. That's one of the reasons the O&M program was kicked off by the state, because they realized that these systems that they put the requirement of O&M permits, there was never a renewal on them.
And Lynn, many of those systems and the community are the category 1, which are just the ones that, would really require pumping. So that is a huge initiative for us is, some of our communities who have these septic systems that were installed 40 plus years ago haven't really been looked at. And when we're talking about clean water, that's a huge thing we need to focus on. So you may be wondering, why are we looking at category 1 and 4 and focusing on 2 and 3 later? Well, 4, because those are the new ones that have a lot of components. 1, because a lot of those have been out there for so many years and haven't really been keeping track of, and we don't want them to get to the point where they're causing harm to our environment.
So I'm concerned that I'm hearing some bad information coming from the board. So at some point in time, you need to take some questions on this.
And how?
And so I'm hearing some really
Public
not good
session.
information.
Hold on, yeah, so they got to finish their committee thing, and then at the public comment session, that's where everybody can ask questions they have it on this specific system, or you can email at info@Geauga County Health.
One thing I will add as well, though, is this is so fresh and new, and we are
We've
part
had
of.
septic systems in Geauga County forever. This is not
Absolutely.
new.
No, not.
No, the
And the whole
program is
system
new.
of testing and so
Pardon
forth
me,
is not
Skip.
new.
The program is new. I would like you guys to explain
Sure. And that's
the O&M program, how that came to be from the state.
And one thing that I will just add is that a huge thing that we are holding up with this program is the necessity for education and buy-in from the community, because we will not roll this out until we talk to individual townships, communities, work with installers, work with service providers, work with homeowners, because we do see some barriers with communication and just making sure that the outreach is provided before anything is done.
We fought the state 10 years ago when they were passing this, and we fought them aggressively.
Well,
And now it's sounding like we're bringing some of the same nonsense back up again.
Skip, let's just save for public comment session. I got everybody on the same page. Once we let one person go, it's not fair that no one else gets to talk. It's everybody's at 2 minutes at the end here, just so it's fair to everybody. Nobody gets feels, I think the main question was, sorry, category 2 and 3, at least that I received from board, category 2 and 3. If the board did not pass it with category 2 and 3, category 2 and 3 would theoretically stay under the 10-year $250. So you're paying more, well, in that one-time payment more, would be a 10-year, and then we would not be on the 1 or 5-year. That's what you and I think Mr. Stajan said.
Right, we're just trying to get everything aligned as this program moves forward, so everybody's on the same permit cycle.
And I think someone had asked, can you mention how, I don't want to say how O&M started, but it came down from the state, it's a state requirement.
Yes, please.
And they're enforcing it now.
Right before the Ohio Department of Health started making laws and enforcing them into the Ohio Revised Code in 1977 was the first time the ODH said, hey, everybody who owns a septic system has to have what they call an operational permit. So the state has required you a permit to operate the septic system, because it's basically your own utility on your property. As the laws changed in 2007, they made an update to the rule. They decided that, hey, these O&M permits are out there. They can't be forever. They can't be 20 years. They have to be at least 10 years. 2015, they revisited the program, still saw that there wasn't a lot going on throughout the state with O&M. So they put in the Ohio Revised Code what the O&M program should look like. The Ohio Department of Health did not do this alone. This was done by state legislators and a committee that was put together. It took them about 2 years to vote on what the O&M program should look like. And then it became law in 2015. So in 2015, this program was started. Health departments needed to start doing something about it. The way Geauga Public Health kind of took care of it is we had our for sale property program. We were using that as part of our O&M. We get audited by the state, and the state comes back and says, here's what the rules state. This is what the program needs to look like. You guys aren't doing that. And so now we're at the point where it's like, okay, we need to start following the rules from the state of Ohio and start putting a program in place. And that's kind of what we're working on right now. So that's kind of the history behind it. Most of the surrounding counties, Lake County has it, Geauga County, Trumbull, Mahoning, it was just in the paper this weekend. If you Google Mahoning County, they are starting their program as the first of the year. Summit, Portage, they all have these programs in place. So it is a statewide initiative.
So you left out part of that history though. And you'll have to forgive me because Bob, I was here with Bob Weissack and I was watching this.
Skip.
We're gonna have,
I've got to keep
cut.
public session.
Being provided bad information.
Skip.
So
And you can do it, Skip, and you can do it public session. I mean, that's why I've got to keep everybody in reality here in check. We got to everybody have their say at the public comment section. I understand we're all passionate about different things. You can have that comment in public session, but you're on the same page, so it's fair to everybody. Everybody gets their 2 minutes. So you're okay. So the from the Board of Health, the motion or the
Okay,
yes.
no, it's not.
Public session is gonna be just like it is on the agenda. It's been on the Facebook page, I think,
Yes.
and our website, and it clearly states that it is at the end of the meeting. Okay, public comment in public session. Excuse me.
So the question for the Board of Health was, would the approval of the actual or the emergency, but it's just the update for the committee right now.
My next question that I want to make sure is, how will community residents find out that they now have to do permits when they have not been doing them for a long time?
So that's going to be all part of the educational program. So before we even just say, hey, you guys are going to do permits, we're going to have educational sessions. We plan on having some meetings, you know, at the public library and stuff like that. We're going to talk about this. We're going to send correspondence out of there. It's just not, we're going to turn around January 1 and say, hey, this is it. So it's going to be a planned rollout. And I can't give you the exact details until the committee has decided on when the rollout date is going to be, how we're going to start implementing stuff like that. And once all that is decided, then we're going to get out and do some public sessions, comments, and different things like that.
So these fees do not start clocking on January 1 this year.
The only ones that they'll start clocking on are new permits being put in because they're already paying an operation permit. Or if you come in to get an alteration on your septic system, you have to pay for an operations permit. So those are the only people that are getting assessed these fees at this time. None of the legacy systems out there at this time are getting assessed any fees.
And the committee did meet with Ohio Department of Health to ask them about FSOP. Can we modify FSOP to meet O&M? And that general consensus was no by two of the top people at ODH, plus Rebecca and Rachel, who are, I don't want to say not top people, but they're more operational level. Because there was effort on that to move that way as well.
Did you say something?
So just a clarifier, Mark, then for people who get new permits, let's say they have a category 2 system, but we're just talking about 1 and 4 today. So are we saying then that they're going to be put on that fee schedule of 200 over 5 years?
That is correct. This way, when the program is ready to go, we'll already have them in the schedule and be able to implement them in the program. Our permits will be the same and we won't have all these legacy permits out there.
Okay, I guess my concern with that is we discussed and agreed on 1 and 4 and not 2 and 3 yet.
In the EH committee, you're saying?
In the EH committee
But
meeting.
we did it. I think you left after we had the discussion about it, but I don't know any more than giving information. So,
Rich, anything to add to that?
So when were these committee meetings?
It was 2 board members, so it's not a quorum. That's what they're.
It makes no difference. If there's a subcommittee, it has to be held in an open meeting. And
So-
if you doubt me, check with your prosecutor.
I do understand that Alta was in charge of that, so I'd have to look at that. So the question Ashley had, Ashley had was 2 and 3 were not discussed when you met. 1 and 4 were.
Rich, what do you recall? 1 and
So
4?
what I recall is 1 and 4 we agreed to, 2 and 3 we did not agree to. So that needs to be revisited in my opinion. So I guess at this point, I recommend we don't, we don't vote on this resolution the way it is at this point. That's my recommendation.
C, right? For O&M fees.
Okay, so that'd be number, that'd be C of old business. So if that's the end of the committee discussion, then we move to old business B.
Can we modify the resolution only to include 1 and 2, 1 and 4?
We can do that.
You could modify based on what you have in front of you, yes.
So do we want to modify where we approve the fees for category 1 and 4 only?
Sure.
So is everybody, so do we have a motion to change that? Ms. Jones?
Okay, yeah. We're going to, move 12.15.21A to adopt resolution 2021-10 to authorize emergency reading of operation maintenance fees for categories 1 and 4.
Mm-hmm.
And that'd be after we do B of old business.
Right.
Yeah.
Okay. Hold that or?
Yeah, you would have to wait until you get to C, and it would be an emergency reading.
Okay.
If you did the emergency reading of it.
I say hold off or rewrite it.
Okay.
That's
That sound good?
That'd be the board's decision.
All right. That sound good? All right.
Okay.
So approve for next month.
Yes,
Yeah.
we're going to table it for now.
There's too much going on right now.
Okay.
Can we do health commissioner update?
Yeah, no, it's the positions, the health commissioner position.
Oh, yes, I'm sorry. Go ahead.
We'll do
Mr.
an
Gregg.
update on this health commissioner. We are scheduling an interview with the health commissioner candidate within the next week to 10 days. And depending upon what happens with that, any action taken, then we'll start looking at the candidates that have submitted resumes for administrator. We do have, we're setting up a interview right now with the health commissioner candidate within the next week to 10 days.
Okay, thank you. So we'll skip C, right?
You would table C. So right now the C is moving to adopt.
So we are going to table.
Yeah, because you want to rewrite the general consensus. You want to see or you want the fees rewritten without 2 and 3, or until you have another meeting to discuss.
Yeah, I want to see the resolution as it's going to be.
All right. So then we're not going to,
So include 1
we're
and
going to
4.
table that for right now.
Further discussion for 2 and 3.
Mark and I will work with Dave on that.
Okay. Environmental health update, we got that in writing, right?
You'll have to vote to table, I would believe.
Or we have to vote. Roll call.
If you're going to table it, because otherwise you're just leaving that on.
Okay, so I guess we need a vote to table the O&M fees till next time. Do we have a motion?
So move.
A second?
Second?
Roll call vote.
Yeah, go ahead.
Okay, Mrs. Jones,
Yes.
Dr. Levan,
Yes.
Mrs. Roman,
Yes.
Mr. Gregg,
Yes.
Rich Perino, yes.
And then, yeah, you can go to environmental health.
So environmental health update, we got that, I think we got that in writing, right?
You got the program, divisional department reports were sent to you via email, so you had an update. Mark, is there anything additional to add that you're aware of?
I don't have anything additional unless there's questions on anything on the update.
No, look good. Thank you.
Okay. Next thing is population health update.
Well, you received my report. Are there any questions on that?
No.
I would like to, the report that I sent you, the numbers for the school data went through the 5th of December. We've since been able to complete a couple more additional line lists, so I might have new numbers based going through the 12th, if you want those instead.
Yes.
So there were, what we have recorded, 479 positive students, 55 positive staff, 623 exposed students, 8 exposed staff. We've completed a total of 297, this is year-to-date line list from the schools. Total number of exposed contacts, 1,745. Of those, 63 became positive. So our actual conversion rate went down. We had it at 3.99, it's down to 3.61. And then
What was the 1,745?
1,745.
For what period of time? I'm sorry.
We went through as of, I think it's for the,
12/15.
yeah, through 12/15.
From which,
No, the line lists are started from the beginning of the year. That's all of them. That's from the very beginning of this school year.
the
That's
school year, September?
correct,
Okay.
this school year.
Yeah, and if you recall, so the conversion rate that we're talking about, back in September, ballpark, I think is when it was, I had the staff, Carol and I had the staff go back, take every line list that the schools provide, because the schools do their own contact tracing, had them go back and look at the kids that went from a quarantine, which means you were a close contact, to an isolation, so an actual positive case of COVID. A proctored test, going to your primary care physician, ER, whatever you have, but actual positive case. I know when I met with the superintendents there, or schools in general, there was discussion of, it's everybody or it's nobody. It's in between, it's whatever. So again, these numbers can be slightly skewed based on, did a parent not report, did the kid not report? But the ones we have, which are proctor tests, PCP, primary care physicians, things like that, we had all the schools let us know of that ratio. That ratio, the highest it's been is back in September was 7.69%. And it's now down to, like Carol mentioned, like 3.61. So again, and we've had 0 deaths for the children, which is fantastic. You don't want to ever talk about that. But in general, the thought was, when we talked with the schools, was if you have a less than 5% conversion rate, and you were still quarantining kids, meaning they stay home for 2 weeks, you're isolated or quarantine, every 100 people you quarantine, 95 would be healthy, theoretically. It's not a perfect number, it's slightly skewed, we know that. But that's the general discussion. We also discuss it with the superintendents on a weekly basis, generally, to look for surges, to look for any kind of inconsistencies, things of that nature. So we do that as well.
And the reason being for us doing that is, like he said, if 95 out of every 100 children exposed do not develop COVID, those kids need to be in school, not at home. So our goal was to keep the kids in school.
Do we have any data that would compare like a year ago, same period? Do you off the top of your head, are we looking at similar numbers? Do you know?
We'd have to, and we created this data.
This, and we've been going
Yeah.
Throughout the school year. We've been doing this. We never did this last year.
Got it. Okay.
Yeah, this was just, as you guys know, I'm just a numbers guy in terms of what I wanted to see. And when you talk to people and they ask you, how do you know? And your answer is, that's just what somebody told me. That's not a very good answer. Most people don't want to hear that. They want to hear, how do you know? Tell me the data behind how you know what you know. So that's why we did this conversion ratio. And we've seen both us and Lake County. So our superintendents meet together. Lake and Geauga superintendents meet together. They've done it for years, is my understanding. We're both less than 5% conversion rates.
Okay.
And schools that have an issue, think they have an issue. I dealt with one today. They've all got my cell phone. They'll call me on the spot. And we talk Saturdays, we talk Sunday, we talk late at night. And they'll say, hey, here's what we found. Here's what we're worried about. How do we handle it? And then Carol and I usually circle the wagons, figure out what the best case scenario is. But the one thing we're trying to avoid, so it's a balancing act between keeping the kids healthy, keeping everybody else healthy, and then the stories that we all knew we hear and heard were, my kid went to school on, let's say, a Monday. On Wednesday, he's out for 2 weeks because he was in quarantine. He goes back in 2 weeks later, he's in there for 2 days. Now he's back out quarantine for 2 weeks. He goes back in for 5 days. Now he's back quarantine for 2 weeks. And we had people that their kids were out 6 weeks out of an 8-week session.
So they weren't even sick.
And they were, and yeah, and theoretically, again, I'm not gonna say Thomas, but theoretically they were not sick, they were in quarantine. So again, those are things that we looked at, we tried to find numbers on, we tried to find statistics on, and then we worked on that. We still monitor with Dr. Reed, the hospital usage, general cases, we still monitor all of that, we still talk to the superintendents, because even though the opinion from some is not this, we don't mandate masks in schools. We're not allowed to. We don't mandate how they follow the procedures in the schools. They do that on their own. And some do choose to follow CDC or ODH or us. It just depends on what some of them do. And they do bring their concerns to us as well. One school in particular is Cardinal Schools. Carol and I have been meeting with them for better part of 4 months. It's probably back in September. We started meeting with them 3 months or so. And we go out there and they have a pandemic response team with the superintendent, I think 2 board members and some bus drivers and then 2 sets of parents. And so we met with them now for a long time on Thursdays when they have it to go over that, see the data, see the specifics, things like that. So that's my long-winded answer.
All right. And how are we doing general population?
You want to go over that?
Our cases, we did see a rise in cases. They're starting to come down, which is good. As far as our, let's talk about hospitalization. We went back through, and I think the report that you have, the child wasn't on there. We did have one child hospitalized with COVID. Obviously, thank goodness, 0 COVID children deaths. 101 hospitalizations as far as adults. We have 16 noted COVID deaths, adults. Our average case rate is about 55.2% daily for COVID. And then in the month of November in Geauga County that was reported, we had 1,658 cases that was ran through the Ohio Disease Reporting System that got reported to them. So our cases are pretty good. If you go down, they're not really changing. They're getting a little bit better, but I had a little bit of update information on like hospitalization as far as how many patients are actually COVID patients in the hospital, how many are in the ICU, how many are vented. As of right now, 12/15, we have 42 patients in Geauga Hospital that are COVID positive. We have 12 COVID patients in the ICU at Geauga, and we have 4 that are on ventilators. That's today's numbers.
And since November 16th, which was we had when our epidemiologists put those numbers together, they're pretty in line with the past month ballpark. Right now, we're a little high on the positive patients, which is 42. You know, if you look at the ballpark averages, it was probably 40-ish, maybe is the average, because 41 is 38, is 39, is 36. The COVID ICU positives, that fluctuates up and down quite a bit. You know, but it's as high as 16 at one point, and right now it's at 12. And then the COVID positive vents has been pretty consistent at 4, with the exception of back in maybe in December, it was down to 2, but it's been at 4 for 3 to 4 pretty consistently. The data that we get reported from the hospitals.
Any other questions? Okay, well, thank you for putting that all together. I know it can be a challenge because everything is always changing, and but I appreciate you and the staff going through all that. Thank you very much. You want to do administrative update?
Yeah, so 2 things. You have the finances in front of you, which everyone got to see. There's nothing too shocking in that. The year-end trends, as I always give you for the finance side of it, are kind of where we'd expect to be. Obviously, we do have some money coming in influx from some of the grants that we billed recently. They're a little behind on. We build those up, and so those are flush again. There is additional dollars for the vaccination grant that we have no details about as of yet, so we've not accepted it. And then there's some additional funding likely for other resources as necessary, and things of that nature. The other thing that is big right now, obviously, is the newest variant of the COVID virus. And, you know, obviously we're hearing it's theoretically not as bad on your body. It's not severe on your body, but it's more contagious. It's just preliminary information. Dr. Reed and I have talked about that in detail about, keeping an eye on that, watching the different trends in the hospitals, things of that nature. The schools, again, we meet almost weekly with them. They're doing the best that they can. They're promoting, that social distancing and responsibility on the student and the parent. If you're sick, stay home, don't come to class, things of that nature. So rely on them a lot. The parents have been, for the most part, pretty awesome with making sure the kids are doing that, and it's able to keep the schools running and in session, and keep all the staff there. And then obviously still the one that concerns me a lot is the mental health issues that we're seeing with kids, suicide, drug use, alcohol abuse. That's still a big one that we're seeing, that we hear a lot of. I know you probably have all seen on the news and other things. It's at a high right now. So those are all things that, it's COVID plays a role, but we also look at the side effects from COVID and from the social distancing and quarantine and things of that nature that come into play with that. So we do monitor that with our team. And then, yeah, the other thing I know the schools promote, which it's going to sound like an oxymoron, but it's the proper hygiene. That's a big thing with, I know it sounds like an oxymoron, but it's one of those things, you have younger kids, you have to wash your hands and do those things. And the teachers in the schools have been trying to make sure that's a big thing to keep the kids healthy in school, because they're worried about it just as much as we are. Every time I meet with these superintendents, their number one priority is keeping kids in school and learning and in those seats. So that's the bulk of it. The other thing that was brought up, there was at least a question, or more or less a question online via an email that was sent that I forwarded almost all those to you. I forwarded most of you to the Board of Health. Was that if someone sends an email to the Board of Health, which goes to the info at email, does the Board of Health get those? Do we filter those? How does that work? So as a means of safeguarding someone filtering those, Alta has access to those as well as I do. Alta actually sends them to me if they're more board oriented or things of that nature, but she also monitors that as a precaution because of that exact concern someone brought forward to me. I don't want anyone to ever be able to say, yeah, Adam just isolated the information he gave to the board. So we do that, and as a board, you're aware of most of the emails that if they say please send to Board of Health, a suggestion for the Board of Health, a concern for the Board of Health, you get all of those, and then you're able to read them, look at them, and make decisions based on what you guys talk about. Other than that, everyone's probably noticed the social media is a little more active than what it was before. Our person that's been in charge of that has been doing a lot with that stuff to keep everything updated, to keep the guidelines updated, to keep working on the website with Dr. Reed to try to update the website as well with more relevant information. So all that stuff is still going on. So there's a lot behind the scenes that is going on for the Board of Health that I know you're made aware of, but given that question was asked, it made sense to talk about it in an open session where, you guys know you're getting the information.
I'm going to talk about the healthiest county.
Yeah, go ahead. I know.
So for everyone that doesn't know, I assume everybody is from Geauga County. I think you all deserve great applause because I saw something the other day that Geauga County is the third healthiest county in the state. So I think that's really, really great. Whether you agree with vaccines or masking or not or whatever, I mean, irregardless, we are a very healthy county. So I'm really proud. I'm really happy with that. So
the bourbon helps.
It could be the bourbon too, right?
Vaccinated Amish. I won't go there.
There you go.
And for those that don't know, I believe I'm not sure I sent the emails an update. Dr. Reed did wish that she could be here. Obviously, we moved the board meeting up 1 week because, again, we're going to be up against the holiday week, which makes it tough for everybody. She did regret not being here, but obviously she has, being a doctor, had plans ahead of time, and we moved the meeting with barely a month's notice. So just an FYI, she does apologize. She did provide you the updates, which is general information from the COVID aspect and things of that nature, and most of it is what Carol went over here, just the general specifics of COVID and the cases and the hospitals and things of that nature. So again, that's just kind of that, just so you're in the loop on that.
So we want a motion for the finance report.
Yeah, you got a motion for finance.
I move that we accept the finance reports for December 2021 as presented.
Okay,
I'll second.
second, you want a roll call?
Yeah, go ahead.
Okay, Mrs. Jones,
Yes.
Dr. Levan,
Yes.
Mrs. Roman,
Yes.
Mr. Gray,
Yes.
and Rich Moreno, yes. So that passes. Okay. You want to talk to Lori?
Yeah, so all of our favorite part is public session. Most of you know me since I've been doing it now for a little while with you. I go over the same points every time we do public session. Every time you're all in here, you see my smiling face. We go over the exact same thing every time. I do expect everyone to act politely and professionally and treat each other with respect. I've given 2 warnings out since I started doing these public sessions. I've told everybody you get 2 warnings. Your first one is just me being nice to you and saying, you got to simmer down a little bit and you can't yell at people. Your second one is we're going to have a discussion if you're going to talk in public session again, or if we have to have you escorted out of the building, if it's rude or vulgar or something like that. I do expect you to treat the board with respect as well, because as you all know, they don't have to have public comment session. This is something they do to let the public speak to them and go from there. Keep your comments respectful. All right. The same thing you'd want them to treat you, treat them the same way. I have my notes just to make sure I don't miss anything when we talk about this stuff. Obviously, the meeting is being live streamed. It's been live streamed before when we've done one back in August. You're all Geauga County residents. Act like a Geauga County resident, and make sure that if there's going to be a meme going out there, or there's going to be a clip of somebody not probably acting a fool, that's not somebody from Geauga County in this meeting right here. All right. I expect the best from all of you. The board, as usual, does authorize 2 minutes per person for a total of 20 minutes. I'm going to go back and I'm going to grab that. Actually, Mark, can you grab that list? Sorry. Thank you. 2 minutes per person. And we'll discuss that. Now, if somebody, as always, if you're not one of the persons that gets to speak, if the time's at 20 minutes and you have not to speak, you can easily email the board. The email is on the website for Geauga Public Health. That email is out there. You can email the board. I do ask kindly, as I always do, that in that email you put for Board of Health, or if the public records request, the public records request, you state something in there so I know who it's going to. There's times where it's many paragraphs, and I've got to read through to find out, is it for me? Is it for Carol Sternero, our nursing director? Is it for Dave Sage? Is it for the Board of Health? And so that greatly helps me ensure that your email gets to the correct place if you have something very specific. Public records requests, we obviously go through those. They do take a little bit of time to get them through legal and everything. We try to push those out as quick as possible. Other than that, you have 2 minutes. Well, if you come up to the podium, if your name is called, you'll do your 2 minutes. When the timer goes off, I beseech you to stop talking, smile and wave at everybody, and you can go back to your seat. Everybody gets 2 minutes. The time that somebody goes above that 2 minutes turns into an equity issue, where somebody's going to take 3 minutes or 4 minutes or just keep on going, and everybody else is going to have 2 minutes. So I do ask for your respect amongst everybody to respect that 2-minute rule by the Board of Health so that we can continue to have public comment session. If for some reason we cannot follow those rules, as you're all aware, it is up to the board's ability to say we're not going to allow public comment session anymore if they do not feel it's being adhered to. As you all know, I'm a huge fan of public comment session because it's your chance to talk directly to the board in an open meeting. I think it's vital to us having the conversation and not all of us being grumpy with each other. But nonetheless, I need you to respect their decisions and their answers. As you're all aware, the board generally does not give a response when you ask your question, because having 5 people all on the exact same page with the exact same answer probably doesn't happen very often. They need to have those discussions, or in the next meeting discuss how they're going to respond to something. We are going to have an FAQ page put on the website. We'll link it from the Facebook to the website. And that FAQ page will go over a lot of frequently asked questions that Dr. Reed can answer, Carol can answer, There possibly EH things on there as well. They'll have questions on there. So we'll have that pushed out as well. Other than that, we're going to get going here. Again, the podium is right here in the center. Please speak up. I know it's hard and on your voice level if you're loud, if you're quiet, but please speak up so everybody can hear you. I'm going to say what I say every time. Don't heckle somebody. I don't care if you disagree with them to the very core of your body. Do not heckle somebody. Let them have their 2 minutes, just like they let you have they let you have your 2 minutes. If you're gonna clap for somebody, save it to the very end. Otherwise, you interrupt their time, and then they don't get to finish their speech because as their 2 minutes is going, you're clapping and nobody can hear them, and the board doesn't get the information across. Other than that, that's the majority of the information. So I was actually gonna take the mic out there, yeah, because it's so the microphone, as our esteemed IT people know here, is not the greatest microphone on earth.
Yeah.
But it is a microphone, and it is sometimes hard to hear people. There is an on-off button right here in the front. I'm going to leave it on off. If you don't want it, you can leave it on off. If you want it, you can turn it on. I'm not going to leave it on though, because it'll get knocked off if you're in all.
You have to be very close.
Yeah, it's got to be a bit close to your face. So it is your decision to do that if you would like to. All right, so the first one that I have is CJ from 12635. CJ, all right. Thank you. You ready?
Yeah.
Go ahead.
First and foremost, it's nice to have this forum, and it's a great feeling to know that we still have a democracy in America where the people can actually voice their opinions to a board. We truly appreciate that. I think we all appreciate that. With that in mind, when I don't have a paper, to look at or bullet points to go over, this is just a common sense guy talking to gentlemen and gentlewomen here. When we look at the the Geauga Public Health stickers on cars and on, the buildings and that, we think of people that have our backs. We think of people that when they walk into a restaurant, us consumers walk into a restaurant, that we know that by you people walking in, there's moldy chicken there, get this out of here, this place is a mess, clean it up for the citizens and for the health of people. We respect that and we appreciate you doing that for us. What we don't appreciate is we've been talking about following the science for almost 3 years now. What we've been hearing in the US is doctors and so-called medical professions not following the science, not following successful countries like India and Uttar Pradesh that have over 241 million people in that state in India, with less than 6.6% people vaccinated and are COVID-free due to that particular state opening up a therapeutic ivermectin. They are 100% practically COVID-free. Other countries are also following suit because that president of India was begging other countries to say, listen, this is working. This is working. Some of our states within India are less than 1% vaccinated. We don't require masks in India. Mongolia, the same way. Some of these other countries are getting it.
Cut you off, CJ. Sorry, the alarm didn't go off, but
some of these other countries are getting it. They get it.
CJ.
All we're asking
CJ,
is for you to follow the science.
I gotta cut you off, buddy.
That's all we're asking.
Please, thank you. Guys, I'm gonna ask again, 2 minutes. I know it's hard to wrap up a conversation in 2 minutes, but at 2 minutes, you gotta stop with the next person in. I know it's frustrating, but that's how we keep this rolling. I'm still gonna ask the ones that wrote no as a precaution, because occasionally someone changes their mind, they get frustrated, they get a chance. Erica? Nope. Valerie? No. Marla? No. And then this one's a yes. Jonathan? Jonathan? Oh, right there, Jonathan. Sorry. Broadbent. I had seen him in the back before.
Yeah, broadband.
All right. Hopefully this will kick in the sound now.
What am I doing? Holding this up?
If you got to turn the on the front of it.
Yeah. Oh, real close.
Yeah.
That's.
It's gotta be really close.
Really close. Okay.
You ready?
Yes.
Go ahead.
I appreciate the opportunity to come up and speak this evening. since I came up here about 3 months ago and led with Tom Hu, because I was new to Geauga County on my way in, and that happened to be the meeting where we were addressing some issues around Mr. Quaid. Since then, I've learned quite a bit. I didn't know much about health departments. I like drinking from a fire hose. I'm exposed to most of the state of Ohio, and I've learned some things. One of them is that we have you guys to be thankful for. My feedback that I get and the experience I've had is that relative to much of the rest of the state of Ohio, I have come to an appreciation for what you guys do. And I've said some negative things, I've said some concerns, etc. But I want to be balanced in my comments. I appreciate what you do. That being said, I do want to talk briefly about the idea and the issue of masking and vaccinations. And I'm going to keep it simple. There are two schools of thought out there, and they are diametrically opposed. There are people who believe that masking and shots are harmful to them and their children and feel very strongly about that. I understand that there are also people that feel very strongly exactly the opposite. And I suggest that in that circumstance, the only logical solution for a board in your position is some form of neutrality, which is allowing for those people who believe in the masks and the shots to pursue that for their families, but also allowing room for folks like my family who believe the opposite. I would greatly appreciate maintaining the neutrality that you have expressed so far. Thank you very much.
Thank you.
All right, Tiffany, broadband?
Not here.
Not here. All right, Rita?
No.
All right, so, Kathy Johnson? All right, Kathy, you ready? Go ahead.
I wasn't planning to speak tonight, but just a really quick comment. And I haven't really thought this through, but I'm a member of the Geauga County Mental Health Board and Recovery Services. And I would just like to echo the fact that I am very concerned about the mental health of our young people in our community with what we've been going through over the last couple of years. I do know that suicides are up, and I know that overdoses are up, and I'm devastated about what is happening in our community. So I will try to arrive the next time with some statistics for you. But I would like to also thank this board, because I believe that each and every one of you care about our community. I would just like to thank you for that. That's all I have for today. Thank you.
Thank you.
You can also email that information if you had some stats. That'd be great.
Skip, I think you get my email from the Rotary. If you can send me, if you can help her send from the board. Yeah, thank you. It says no, but Chris from 9380. No, all right. Susan from 8213. Thank you for doing an awesome job so far, everyone. It's greatly appreciated, more than you could ever know.
Thank you for serving on our health board. Thank you for this opportunity. I would just like to ask that we have no mandates for masks, shots, vaccines, and no vaccine credit card, express cards, you know, that you have to show that you had a vaccine passport. Thank you. If I choose to not wear a mask, that's my choice. If people wear a mask, I respect that, but don't impose it on me. I won't impose what I want on anyone else. If that's possible, please. And then it's the same with shots, vaccines, etc., and no discrimination thereof. And then I also have a suggestion, and maybe if you do this already and I missed it, I don't know, but in our local paper, maybe once a month, put a little COVID update. What does vitamin D3 do for you? How can we build up our immune system? What are the stats this month, or, you know, something positive, realistic though, not, you know, lying or anything like that, deception, but something about HCQ or ivermectin, or how do we build up your immune system, and the importance of exercise and things we may already know, but there's more to fighting this than fear. as far as can't talk to anybody, and I'm afraid of this, and I'm afraid of that, and get paranoid, it's like, no, we're still allowed to go outside, we're still allowed to talk to people, but maybe put something positive to build up people's confidence with this, that we're in this together and we can fight it together. But again, no mandates, please. I'd still like to believe that, as for me and my house, we will serve the Lord and the United States of America, please. Thank you.
Bill, do you want to follow that up?
Should we just, once again, reiterate, we don't have mandates?
If you would, I mean, that would be up to the board if you'd like to.
You want to say that?
They're
You know,
directly-
Susan, all your comments are fine, but we haven't had any mandates. And
I
we've
know, but I
been
don't
saying
want
that.
any.
Okay.
Okay,
I mean, that's the basic thing. And my thing is, if you could put, I'll type it, if you write it up, I'll type it.
okay.
A little column in the local, in the Chesterland papers, whatever papers, of something positive about how to fight COVID without being so fearful. If
Okay,
possible.
thank you.
Skip? All right, Skip, you ready? Go ahead.
No.
Oh.
Thanks for the opportunity, and I apologize to you. You all know me. You know I'm a passionate guy. And so I wasn't, yeah, that's right. Throw the mallet at me, okay. I was here to represent as a member of the mental health board and to echo what Kathy had said. I'm very concerned about what I'm seeing in terms of certain actions leading to mental health issues. Our kids in school, particularly having to wear masks and being separated. I'm not sure the virus is that smart. It knows 6 feet. It can stop at 6 feet. I'm not sure that we get that smart of a virus. But let me do this instead. You've heard that message a number of times. You're going to hear that from some other people. I'm very concerned at what I heard in terms of the septic system thing. I was here when Bob Weisdeck, who I consider a hero in this county relative to the septic systems. And we were fighting those septic systems and that law for quite a while. We lost by a few votes down at the state. And he worked out an agreement, and I'm thinking that agreement's still in place in terms of a waiver for Geauga County if our septic systems meet a certain testing profile. And we were testing at a profile in the 90s at one time. And I want to know if that's still in place. Because if that's still in place, that should still apply to our county. And we ought to still be doing that method. Because we had a waiver with the state health department one time on that. And so I think that was left out. Let me make a public information request. This is a public meeting, and I'm going to make a public information request of the committee. I want to see the notes and the reference material that came out of that committee upon which these decisions are being made. I want to know who all is on that particular committee. So, thank you.
Skip, can you email me the specifics of my email? I'll give you my email. I'm just looking for.
You want to know the specifics on?
No, just I want you to, if you can write out what you just asked in the public record, so I don't miss anything, or in case you have an additional request.
Put it in writing. Just
You don't have to. I'm asking. Would
send
you
me
put
an
it in writing?
email.
Yeah, it's
Okay.
pretty straightforward. I can.
Okay. I just want to make sure I don't want to miss
That's
anything.
not
Is all I
big.
want to do.
Yeah.
I just want
This
to.
thing's not working, so I don't know.
Yeah.
You gotta put it like right
I think I'd have to eat it and it's still not working. So whatever it's worth.
We have the IT people here.
Those are the IT people?
Yeah.
These things
That's
are
not-
$60 and you can buy a new set of mics. You know, and they work.
That's not ours, that's his room. We don't.
No credit at all.
No, I don't want to be associated with that microphone.
Todd Albright. Is Todd still here?
Yeah.
Oh, there he is.
Yeah, well, this actually.
Ready, Todd?
Yes, sir.
Yes, go ahead.
Okay, so this is kind of directed at you guys. I'm in the school sphere. I get all kinds of things said to me a lot now. In your data, you said you look for trends. I have heard that kids now are treating this like the kissing disease when we were in school and passing water bottles around and intentionally getting each other sick so they can get 14 days free. I don't know if that's true or not. And it actually shows because there was no sickness during homecoming because they actually wanted to be there. I don't know if you noticed that. If you could just let me know, that'd be great. The second thing is I'm a big numbers guy. Is it possible, because I'm just really, I don't want to hear COVID anymore. I just don't. I don't know if everybody's on that same page. Could we start having information about the other things that are affecting people? So people kind of get their minds off of this is not the only thing going around. That'd be just excellent. That's all.
I think we've actually tried, I mean, since the change in regime, that was one thing we noticed that Facebook was constantly COVID. And I think when the changing of the guard came, I think we've been trying to put more other issues on the on Facebook other than.
We've been doing more healthy, eating healthy. But
Right.
the big thing was hand, foot, and mouth, actually, about a month ago. Hand, mouth, and foot was huge, actually, in a majority of the schools, I'd imagine, right? Majority. Yeah, so we dealt with that. That was a big thing at the time. We do mention that the numbers are the numbers are the best numbers we have, but
sure. I mean, it's called like the COVID dashboard. I mean, if we could be like, just change it to like health update or something.
I think we are changing, the website is changing and we are trying to expand and you know, it's funny, I talked to somebody, I don't know, a couple of weeks ago and I was saying, you know, I know the meetings are, you know, it's great that everybody comes and talks and everybody seems very concerned with COVID. And I mean, don't get me wrong, it's a serious thing. I take it seriously, but it is not. And that was my point about being one of the safest counties in the state. It is not, you know, there's a lot of other issues in this county. Environmental health, you saw how, you know, Mr. Claypool got all upset and whatever about as soon as we were talking about it, you know. And regarding, like you said, you know, kids in the school with whatever you were saying they were doing, I mean, aren't you on the school board? So you probably would find that information out before we would.
Well, I'm
Because
not officially on there.
yeah, you start
but I
in
think you
January.
actually have to talk to the students. That's the issue about that. So
That'd be your
but I was
opportunity.
hoping in your data, I don't know if it seems like it's updated almost daily, if you would notice like when a special event happens, if there's like less.
We do track
That's
that.
something we can be mindful of. Absolutely. Thanks for bringing it to our attention. I have not heard that one yet.
I just curious. Thank you.
Thank
And I do
you.
appreciate your, again.
Thank you.
I'm going to guess that you do not want to talk about Lena and Luna.
No.
No? So like not a chance. All right. I have Ed from 16733.
Still no.
Still. Thank you, Ed. I've got a Rich from Chardon. Well, it's Rich Johnston. Rich. You want to?
And let me add too, for the live stream purposes, the webcam is attached to this podium. So every time someone hits it or moves it, the camera does this and people at home go, wow! So
Roll that up there.
okay, yeah, well, that's getting our sound. That's what that's for. The mic is there, the camera. So,
Yeah.
So just
Have
watch
the
the podium.
technology side.
Yeah.
Yes. Rich, you ready?
Sure.
Go ahead, sir.
Merry Christmas, Happy Hanukkah, and Happy Holidays to all faiths. And if you don't have a faith, Happy Holidays to the unfaithful. All I can say is no mandates, please, in the future. My body, my choice, not yours. I attended a Chardon School Board meeting recently, and they threw up a bunch of slides very quickly. And of those slides, I think one of them said something about that they gave the Chardon or that they gave the health board $28,000 for something, and I don't know exactly what it was for. And I'd like to find that out down the road. What would they receive? Now, this is from COVID funds. And I don't know what they gave it to them and if they did what it was for. And I wonder if the school board ever contacted the board as far as how to spend the money that they got from COVID and what they should do to help our children. Also, congratulations to the board. I understand that you just received accreditation from the PHAB and are recognized well by the CDC. So congratulations for that. And I understand your mission is public health services on monitoring, education, and promoting community and environmental health services in Geauga County. I'm going to ask you to put this to the test. So far, there has been 12,000 people that have COVID or gotten COVID in the county and 187 deaths. We have people in Washington that are in charge of not doing their job. And I would hope that you people could follow up with them or our congressman as far as having them removed from office. They're just not doing what they should be doing. And I'm talking about Anthony Fauci, and the president of the US. I think you people can talk to our congressman and do something about that. Or at least try.
I gotta cut you off, Rich.
Thank you.
Thank you.
That's the sense of threat.
Rich, just to answer your question, so that it doesn't sit out and linger. So Geauga Public Health did issue or has offered to issue checks based on a grant to the local school districts, and that was to assist with the services they provide with monitoring surges and things like that with COVID. It was based on the enrollment status of how many kids are in those schools. And it was a grant that the health department had through Ohio Department of Health that we were able to take some of those dollars and provide them to the schools. Don't think of strings attached like there's some conspiracy theory. It was literally, if you let us know ahead of time, or when you find out if there's a surge in cases, if you're seeing that it's specific things that are causing it, or other health issues in the schools, it was that. It's a one-time, over 6-month contract type of a deal. So each of the 5 districts in Geauga County got based on their population, or sorry, not population, enrollment.
And they gave that money. What information exactly did you provide them then for $28,000?
No, we gave money to them.
Oh, you gave.
It was the other. If it's the one I'm thinking about, again, it was for them to provide assistance. If so, they do what they call a line list, which is required by the state. They have to provide line lists to us of close contacts, things of that nature. And our main thing was looking at surges. So if they see a surge in COVID amongst a certain class, amongst a certain area, they already do that, but they can provide it back to us, and then we can provide some financial assistance on that.
Thank you.
Yep. I have a Carolyn Brakey. No, thank you. All right. Rachel Hutchinson. Okay. Skip if he wants to talk again. Not that you get a chance to, but your name was on here twice. Not that you're getting a chance to.
I guess he gets 5.
I've got 9098. I can't read the first and last name. I apologize. Yeah, your writing kills me every time.
Oh, get out. No, I'm not going to do it. I'm going to pass because of timing.
All right. Mr. Byler?
No.
No, Mr. Byler, no. Jim McNeil?
Yes, sir.
All right. Yes, sir. All right. Jim, you ready?
Well, folks, we have good news. I finally found a mask that's good for COVID. That's the good news. It's bad news. That one isn't. Folks, on August 2021, CDC Lab Alert asked FDA to drop emergency use authorization for the PCR COVID test. As of 31 December, no more PCR per CDC, FDA. Why? Because of a horrendous number of false positive tests. The number of COVID cases indicated by PCR testing is no longer pristine data. Should be critically reviewed, and any guidance based on the number of cases should be appropriately revised to reflect the actual science. Dr. Kary Mullis, inventor of the PCR test and a Nobel Prize winner for its development, said they never had COVID-19 genetic material to design the PCR test panel, so we contrived it from bits and pieces of previous COVID viruses. Many of us have had coronavirus exposures and have bits and pieces of those coronaviruses still in us. The contrived PCR test has never been capable of determining which coronavirus it sees, COVID-19 or another coronavirus. It sees everything as corona-19. Dr. Mullis also said, quote, Fauci doesn't know anything about anything. At the top, they are all just administrators that know nothing of electron microscopy or real science and shouldn't be anywhere near the jobs they are in. They do not possess the ability to judge who is and is not a good scientist. They have an agenda. Geauga Public Health, will you still follow Dr. Fauci's unscientific dictates, or will you use good science so you can, and preventative measures like quercetin, zinc, vitamin C, vitamin D, so you can make really good decisions for our children? What are you going to do? Thank you.
2 things, Jim. One, can you send me,
1 second, Ray, 1 second. Go ahead.
can you send me your info and your article
I
supporting
would
that.
be delighted.
And number two, if you'd like a UH bag to replace that clinic bag, I guess.
That was done for a reason.
Oh, that hurts.
And I'm gonna ask everybody one more time, treat everybody professionally. I know there's some jokes sometimes, but you know, it's not always the most professional thing to point out somebody else, refer to specific people or certain
I
things.
just have one question, I just have to say one thing. I get.
I will talk to you after, because you're already skipping your turn. I will talk to you after.
I just want to say something, I just want to make a comment.
You know, I will talk to you, I've got to keep it fair. Otherwise, it opens up Pandora's box. Whit Burns? No, all right. Jonathan Tiber? The maybe, I was, double checking, so it's maybe. Jennifer Weinreich? There she is. You ready, Jen?
Yeah.
Go ahead.
Hi, I think you've already talked about it a little bit tonight, but I wanted to ask about communication. I know we don't have the budget of Geauga County Public Health, but their website has a lot of information on it all the time. And I see other public health departments around the state that have a lot of information. And you talked about an FAQ, that sounds fantastic. And I have noticed the effort to have more information about things other than just COVID, but I would also still like to see the COVID information, the numbers. Most of those pages that I've looked at are updating them pretty frequently, maybe weekly, and some of them even daily, with the positive cases and hospital beds availability and those kind of things. So I hope we can get back to a little more daily updates or weekly updates of that kind of information. There's a lot going on right now. We've had some milestones this week. We have a new variant and upswing in Ohio and across the Midwest. So it'd be great if you could do that pretty soon as we get into January after the holidays, things like that. It would be nice that if we could see that information.
Okay.
Thank you.
What's the doctor? Carol Cernero, maybe some doctor, who knows?
Wow.
Dr. Cernero. Carol and I have been trying to work on that to provide those updates as frequently as possible. There is lag time. I know there was a frustration recently about the different data models and how they present the data on COVID specifically. We always say, keep in mind, there is a lag between when the hospitals give us the data, when ODH gets the data, and when we can post the data. And so there is a consistent lag. The other thing we noticed, or we know, is that I was talking to our epidemiologist today, when the state updates for the prior month, they can go back and make changes to deaths, and they might increase. I think the last one was 26 or 6, something like that. So they will go back and change that, and then our data might not match unless we get their corrections, which then we would have to work on ourselves. So the goal is though to update it, and Dr. Reed specifically, sorry, I should stand up. Dr. Reed specifically and our person who's handling social media is working on the website in conjunction to update that, provide a little more information, and then do the FAQ. My goal would be, and this is the gold standard, but the goal would be, as we have meetings like this and someone asks a question, that goes onto the FAQ if it would be an FAQ question. I mean, some of them aren't FAQs, but that way the public could go and say, hey, here's what we asked, here's what a real doctor said, or what an epidemiologist said, or a nurse said, and go through that. And obviously we'd cite sources and things of that nature. So that's the goal. We actually are hoping to take on an extra part-time epidemiologist to help with some of these things, because again, we're just tight on personnel, especially with if anyone has come in to give your shot or to talk to a nurse or anything like that, there are hundreds, if not close to 500 or 600 test kits for COVID out here that they've had to bag individually, put names on, prepare, that people can then come and pick up. And believe me, that takes a lot of time. So we are working on that though, to get that data a little bit quicker out there. All right, so the 10th and final person, depending on who is going to say yes. The first one is, I'm going to butcher that first name, 9646. No, all right. Lisa Hickman. No. Ellen Naylor. No. Drew at 10945. He's just looking at me like, keep going, just keep digging that
I've
hole.
heard it butchered many different ways.
That's why I went to the address, because it was not getting any better than what I had just said. All right, you ready, sir?
Sure.
Go ahead.
So I just want to thank you guys. I know you are under probably tremendous pressure. You got a lot of the public breathing down your back. And, you know, I have a business, and the guy brought me in as a sub on a project. And the one thing he told me is, Drew, we have his trust. You have no idea how much pressure that is to have someone's trust and expect to carry it through to those high levels. And you have the public trust. And so that's a lot to carry. I am confused about all these permits and costs in 10 years and 5 years versus what's been happening. Does that mean like old systems have to be updated? What does that mean? I don't know what that means.
Once you finish, then we'll. Yeah.
Okay, and then all the different fees and everything. What substantiates why there's a fee or whatever. So, and then the last thing I wanted to ask was information that you're tracking. Is there a way to, when you're logging all that and publishing all that, if you could give a little bit of more information on how many of these cases are vaxxed versus unvaxxed, so we have like some kind of an understanding what's going on even in that world. So that was my, that's it.
All right, well, thank you. Thank you. The first one I'll give is to Mark, since he's here, about the question about the permitting. And are you relatively confident you can answer that?
I believe so. When the fees that were up here, so just like if you go to the building permit, you got to get a permit to do electrical. So if you install a septic system, you have to get a permit to install for that septic system. Along with the permit to install, the Ohio revised codes, it says you also have to have an operational permit. So that's a separate fee in a separate program. So once your permit to install is done, your system's installed, you're good. That's good. The operational permit has been given a expiration date of no more than 10 years. It is basically, the operational permit is something that you need, things that you need to do with your system to keep it working correctly and effectively. And so basically the dates that you heard, 20 years, 10 years, 5 years, is a lot with the progression of how the Ohio revised code went. First they said there was no expiration of these, then 20 years, then 10 years, and then now it's a max of 10 years. But what we've done is follow what a lot of the counties around us are doing. And in order to keep up with the maintenance a little easier, because some systems have required maintenance twice every year. Some it's once every 5 years. We've set up the permit cycle to be just like that. And so that's where those fees kind of came up. The program is not a replacement program. It is not that we're going to come out there and you have to replace your system because your permit is expired. It's not that at all. It's not a mandatory inspection program. What it is, it's more of a maintenance tracking. If you're doing your maintenance, you're getting your tank pumped, you've got your service contract, you're getting service on your system, we're tracking that for you to make sure that you're in compliance with the Ohio revised code rules. Does that make sense? Make sense?
Yeah, makes sense to me. It sounds basically like if your system's failing, you may have to do something about that, but this helps keep an eye on it.
It's really protecting the environment, obviously. Jim, I'm going to hold off. The other question, or the other question was about.
Speak to that. So you're talking about vaccinated versus unvaccinated. You know, there's a lot of us board members are Cleveland Browns fans. I don't know if you guys heard, but just today, I guess there's 12 players that tested positive for COVID, and the head coach has tested positive for COVID. It's also my understanding that there is only one player that has not been vaccinated. So I guess with that being said, and I'm not a scientist, I'm not a doctor, but you know, even if you have the vaccination, that does not make you 100%, you know, not get sick. But they do say that if you are vaccinated and you do get COVID, you won't get hopefully as bad a reaction. The other thing I'd like to say too, which Skip Claypool left, but I don't know if you know, but the health commissioner, Mr. Weisdack, actually passed away a couple weeks ago.
I was going to ask for a moment of silence after you're done with this.
Okay.
For him.
You want to do that now?
Well, the vaccinated versus unvaccinated, I momentarily asked Carol. So we don't get that information because it's more at a hospital level than ours. So that would be specifically, again, I don't think we get all this data just like flowing in nonstop. We don't, and a lot of times, it's frustrating, but the schools are in the same boat. So, Todd's gonna be on the school board here. We get information like hours before the governor releases it. And that's how we have to put things in place and react and things like that. Extending public comment session or no?
Can I comment on that?
Sorry, go ahead.
It's hard even for me to keep track. I have patients that are floor nurses, ICU nurses, and other docs, and you ask one, and they'll say 60% are vaccinated, 40% are not. And then you talk to another one, 90% are vaccinated, only, or aren't vaccinated, 10%. Personally, as an outpatient physician, I've seen a handful of people that are vaccinated both. I don't remember if I've seen any with the booster, but the boosters are relatively new. But I'm seeing a handful of them, and some of them have gotten sick. And there's, one thing they say, well, how do I prevent COVID? Control your diabetes, lose the weight, keep your blood. It's probably the best thing you could do to not get sick and end up in the ICU. So the numbers are hard to get, but it is a very good question of, what percent are getting, and of the kids, that's really tough. The kids are tough because, I think they're just tough to measure, just because they don't get very sick. They don't always get tested. And I don't know that there's enough of them vaccinated yet to even say, but anyway, I think the numbers are going to be very hard to do. And because I think people have agendas, it's going to be sometimes hard to, one group might say it's filled with 90% unvaccinated. Another group will say this. And I mean, the CDC should have some numbers, but that doesn't cover local. So I think it's just going to be hard. On a positive note, before Jim has his comment, or it's up to Adam, I heard interesting information about Omicron, and I don't know how true it is. I haven't looked that deeply into it, but supposedly it's very, very contagious. You need less viral particles, but the symptoms are so minimal. And this virologist was saying that, and this is me being hopeful, but that would be the perfect end to a pandemic. Because if you can, all the unvaccinated, all the people who are vaccinated who don't have natural immunity, the virus naturally will do this to kind of take care of the rest of the population without killing them off. So that was a positive thing. And it was a reputable guy, and it made perfect sense that if this thing gets around and, you're maybe sniffles for a day or two, cough for a day, number one, people probably won't go out and get tested if that's all they're. Not that that's a good thing. I'm just saying the stats will change, but what a way to get natural immunity without having to get sick. And Mother Nature, I don't know if vaccines did it, but whatever, this
So
might
Patty,
be promising.
it's like the ordinary flu then. Something's like the ordinary flu.
Probably even less. And that's how the progression of the virus just happens. It's mutated so much that it's.
All right, so we're going to end public comment session. One thing super quick is that to give some kudos to one of Carol's staff, Sarah Sullivan. She came up with a little like a help card for getting your test kit out there and how to follow the instruction like that. And we found out yesterday or something like that the state started sending out the exact same card on their own letterhead. So Sarah, as dumb as it sounds, she did good work, and the state took her card. So it was nice for her though.
In our testing kits, if we have some that are proctored and unproctored, whatever the state sends us. So we devised a card that went in the kit that if you did test positive and you needed or wanted to report it, how to go about doing that. And these were created and kind of almost like blow-ins that you would see in a magazine, and we put them in with the test. ODH rolled out, we've been doing this for about a month, the exact same card that they're now sending with the test, and it's almost verbatim for what we were saying, and we were doing it for almost a month.
The second time they copied us, school guidance, know this.
Yeah, so.
Right. All right, so the question, does the board want to extend public comment session?
One more.
2 minutes.
Okay, that's up to the board, so go ahead. I have to ask, so.
I signed up, is it okay? I'm fine.
Not in charge of it.
Okay, thank you. My name is Shelley Lewis. I'm president of the League of Women Voters of Geauga, and I'm here on behalf of that organization tonight. So first of all, of course, we want to thank the board for providing this opportunity for the public to express their viewpoints. We know that you don't have to do that. And of course, we're on the side of allowing public input, so we really appreciate that. We also want to heartily thank ADP, these gentlemen here, for providing a live stream option so that folks who are unable to be here in person were able to monitor the proceedings and also submit comments and questions via chat. We had 32 participants for the virtual option, and that was with only about an hour's notice. So we think that it's an important option to provide. I have comments from 3 of those participants. I wanted to see if the board would let me share those from the individuals in the chat comments.
You can do it in under 56 seconds.
Okay, here I go. Christine Lester wants the board to consider the mental health of healthcare workers. Alyssa Rasmussen would like to know the total ICU capacity at Geauga Hospital. And she also questions the assertion that you made, Adam, that Omicron is not as hard on children. She'd like to have your source on that.
I actually said it's not as hard on the body. Sorry.
She has a different source, so she would like to know what your source is. And then finally, Kate Baker wants to make sure that the board is aware that she supports masking and feels in-person attendance is not a safe option. So again, I thank you for the opportunity to share those viewpoints.
Thank you.
Thank you very much.
Adam, I can speak to some
Yes,
of that.
you, right?
The number of beds or
Yeah,
whatever?
so with the 2 things, I appreciate the consideration as healthcare workers in general right now, not just with COVID, but with the increased acuity of patients and volume of patients that we've been seeing. It is very hard on everybody, especially as we have many leaving the profession, whether that's to take not just the profession, excuse me, but leaving their current jobs, either to take travel jobs or leaving the profession entirely. It is putting a huge, huge strain on, I can speak to our hospital system, as well as the others in the area. So I appreciate the considerations and thoughts for healthcare workers in general, but also all of the other people who are enduring any issues during this pandemic specifically. I don't think it's just healthcare workers that are affected by this, although the issues are most concentrated, absolutely, with sick patients. So I appreciate that. In terms of your county hospital, UH Geauga, typically, and what I can speak to, I'm their emergency medicine clinical pharmacy specialist. So I can speak to what I know with that, but our ICU is a 12-bed ICU. And currently, we have expanded our ICU. We have had at one point 26 patients. So we have flowed over to another unit. Now, not all of these patients are COVID, but just keep in mind that people are still coming in for other critical care needs as well. So any additional strain right now is really just going to be the straw that broke the camel's back on our healthcare system. But our ICU typically runs 12 beds. It's an open unit, which means patients can be in the ICU and be seen by other providers. We do have dedicated intensivists there. But they don't have to be COVID to be in the ICU or out of the ICU. We have several units in the hospital where we can treat COVID patients depending on their needs at that time. But we definitely, our volumes have significantly gone up, whether that's because people were delaying routine care for other needs, whether they're comorbidities during the time where everything was shut down, they didn't have access to transportation and those things just snowballed, or whether it's COVID itself. There's a lot of issues going on that are putting strain on the healthcare system, especially in our county. But again, just in summary, ICU is typically 12 beds, but we've had a lot of changes as well with changes with UH system and changes with Richmond Bedford hospitals and getting patients from Geneva, Conneaut, Ahuja, Samaritan, patients from Columbus, Cincinnati right now because those healthcare systems are so strained. So we're getting an influx from everywhere. So it's beyond 12 beds, absolutely. But in the good old days when it was just typical critical care patients prior to the pandemic, prior to other issues, it was 12 bed.
And then I think, and if I stated students specifically, I apologize. I know we were talking about schools in general. My comments were more of in line with Dr. Levan's, that what we're hearing from the state and other places, that Omicron, as an example, is less intrusive on the body. So you're having less severe side effects, and put it that way. And they've not, I'm not aware of them delineating between children or adults. It's just been, it's a less severe version of COVID. And I think, Dr. Van has, I'm sure, the sources being an MD, but that's what we're hearing across the board from every health department. Sorry, the health departments are being told that and getting that information in, is that it's a less.
Other countries like Africa that have seen more of it.
Yeah, if I said students, I apologize, but it's across the board. We're hearing that it's just in general less intrusive on everybody.
You didn't mention children at all.
Okay, and if I did, I apologize. Believe me, I am not perfect. I will admit that every day.
I will add one final caveat to my statement is with respect to any hospital information, capacities, things like that, it's always best to reach out to the hospital itself because those numbers are changing, capacities are changing. If you, no, because that would be like a unit. I would ask for somebody on either.
Infectious disease, I think.
No, because
We're not gonna
infectious
get the
disease
doctor on
is
call.
one infectious disease doc that we have. So I would almost ask for if they have anybody in like their public records or anybody
Admissions,
on
maybe.
their advocacy team who you could discuss issues with. They do have a hospital board, but they definitely have like a media team or somebody with that respect. Or you could just simply call the operator and ask, do you have anybody that could share more information with me regarding how the ICU is, regarding how COVID is. So you have people who can share that with you. But a nurse, like the nursing leadership, I just don't want to designate a person so they get an influx of calls. But they do have nursing leadership teams. But if you ask for a nurse manager, it wouldn't be like a specific unit nurse manager. I would just ask for leadership or somebody who can give you more information because it is always changing. I can tell you that one day we have 26 patients. You know, it could be 12 when I get back tomorrow. It is changing, but that's why I would say contact the hospital directly and ask for somebody if somebody is designated to share that information. If you call the operator as well, there's also a COVID hotline number they can give you for Central UH. You can provide more information as well. Thank you. That was the word I was looking for, is public relations. I could not think of the word.
Yeah, probably public relations in a
Yes, that would be your best source. Again, I can speak to what I know from an adjacent department and the patients coming in, but that would be your best source.
And then I would ask that if we're done with that discussion, have a moment of silence for Mr. Wyzak, the loss of his life. All right, and then I'll hand it back to you, Mr. President.
Thank you, Adam. So the next meeting will be for the Board of Health at 5 o'clock on January 26th in this room. I'd like to wish everybody a Merry Christmas. If you had celebrated holiday last week, Happy Hanukkah. Hope you all have a great Happy New Year. And thank you all very much. Meeting's adjourned. All right. Oh, vote to adjourn. Okay.
Vote to adjourn.
Lynn.
Vote to adjourn.
Vote to adjourn. So moved.
Second.
All in favor? Aye. Okay.
I know.
Thank you. My name, actually not my name.